Καλησπέρα σας. Προσφώνηση από τον Πριτανή του Εθνικού και Καποδιστριακού Πανεπιστημίου Αθηνών, καθηγητή μελέτιο Αθανάσιο Δημόπουλο.
Κύριε Κοσμήτωρ, κύριε Πρόεδρε, κύριοι καθηγητές, εκλεκτέ προσκεκλημένε, φοιτητές, αγαπητοί συνάδελφοι και φίλοι. Έχουμε την ιδιαίτερη τιμή σήμερα να απονέμουμε την μεγαλύτερη τιμητική διάκριση του Πανεπιστημίου μας, αυτόν το τίτλο του Επίτιμου Διδάκτορα της Οδοντιατρικής Σχολής, της Σχολής Επιστημών Υγείας, στον καθηγητή Julio Acero, καθηγητή στο Πανεπιστήμιο Αλκαλά της Μαδρίτης, στην Ισπανία. Όπως γνωρίζουμε, η απονομή του τίτλου πραγματοποιείται μετά από εισήγηση και απόφαση του οικείου τμήματος ή σχολής και έχει την έννοια της αναγνώρισης σε κάποιο επιστημονικό πεδίο το οποίο αποτελεί ιδιαίτερη εξειδίκευση του τιμωμένου. Όντως, ο καθηγητής Acero είναι επικεφαλής του Τμήματος Στοματικής και Γνάθο-Προσωπικής Χειρουργικής των Πανεπιστημιακών Νοσοκομείων Ραμόν y Cajal και του Puerto de Hierro στη Μαδρίτη της Ισπανίας και είναι καθηγητής χειρουργικής στο Πανεπιστήμιο Αλκαλά της Μαδρίτης. Έχει σπουδάσει και ιατρική και οδοντιατρική και τα ειδικά πεδία του ενδιαφέροντός του είναι η ογκολογική και επανορθωτική χειρουργική της κεφαλής και του λαιμού, καθώς και η αναγέννηση των ιστών. Έχει ένα σημαντικό διδακτικό και ερευνητικό έργο με διεθνή αναγνώριση σε αυτούς τους τομείς και αυτό θα παρουσιαστεί από τον καθηγητή κύριο Περισσανίδη. Ο καθηγητής Acero ήταν ερευνητής στο Ισπανικό Εθνικό Ινστιτούτο Υγείας και στο Συμβούλιο της Ευρώπης στη Γερμανία. Είναι μέλος του Ευρωπαϊκού Συμβουλίου Στοματικής και Γνάθο-Προσωπικής Χειρουργικής και επίσης διακεκριμένος συνεργάτης του Royal College of Surgeons στην Αγγλία, καθώς και μέλος και εξεταστής του Διεθνούς Συμβουλίου Πιστοποίησης Ειδικών Στοματικής και Γνάθο-Προσωπικής Χειρουργικής. Έχει διδάξει ως προσκεκλημένος καθηγητής σε διάφορα πανεπιστήμια σε όλο τον κόσμο. Είναι επίτιμος καθηγητής στο Πανεπιστήμιο της Φεράρα στην Ιταλία, στο Πανεπιστήμιο του Βελιγραδίου στη Σερβία, στο Πανεπιστήμιο του Βουκουρεστίου στη Ρουμανία, καθώς και στο Εθνικό Πανεπιστήμιο του Νορντέστε στην Αργεντινή. Λόγω του σημαντικού ερευνητικού του έργου και της απήχησης που έχει το έργο αυτό, έχει πάρει ειδικές αναγνωρίσεις και από το Πανεπιστήμιο της Μεσίνης στην Ιταλία, το Πανεπιστήμιο της Μαλαισίας στην Κουάλα Λουμπούρ, το Πανεπιστήμιο της Φλόριντα και στο Πανεπιστήμιο Vanderbilt των Ηνωμένων Πολιτειών της Αμερικής. Ο καθηγητής Acero είναι μέλος της Ισπανικής Εθνικής Ακαδημίας Οδοντιατρικών Επιστημών και της Εθνικής Ακαδημίας Οδοντιατρικής της Αργεντινής. Είναι επίσης επίτιμο μέλος της Λατινοαμερικανικής Ένωσης Στοματικής και Γνάθο-Προσωπικής Χειρουργικής, καθώς και της αντίστοιχης Ένωσης Αυστραλίας και της Νέας Ζηλανδίας, καθώς επίσης και πολλών άλλων εθνικών και διεθνών εταιριών. Επομένως, αντιλαμβανόμαστε με όλα αυτά ότι ο καθηγητής Acero έχει μία σημαντική συμβολή στον τομέα της γνάθο-προσωπικής χειρουργικής και επομένως με ιδιαίτερη χαρά θα του απονείμουμε το τίτλο του Επίτιμου Διδάκτορα της Οδοντιατρικής Σχολής του Εθνικού και Καποδιστριακού Πανεπιστημίου Αθηνών. Σας ευχαριστώ πολύ.
Παρουσίαση του έργου και της προσωπικότητας του τιμωμένου καθηγητή από τον καθηγητή Στοματικής και Γναθοπροσωπικής Χειρουργικής του Τμήματος Οδοντιατρικής, Χρήστο Περισσανίδη.
So, dear Rector, dear Vice Rector, Dean of the University of Athens and President of the School of Dentistry of the University of Athens, It is my great pleasure and honor to be here with you in order to award the doctorate, the honorary doctorate, to Professor Julio Acero. Professor Julio Acero has a curriculum vitae which is large. We can talk many hours about his achievements, and as you already heard from the rector, he's currently the head of the Department of Oral Maxillofacial Surgery in the University in Madrid, and also he's currently the president of the European Association of Cranio-Maxillofacial Surgery. However, it's also very important to highlight that in the past he had many important positions, like the president of the International Association of Oral Maxillofacial Surgery, and also he was the past chairman of the education committee of the association. Of course, he started in Madrid, where he received his medical degree and his dental degree and also his PhD. And through all these years of this huge career, he has been invited in many universities and in many places around the world in order to teach and to educate. And of course, one of his most important appointment was the position of the Education and Training Officer of the European Association, and he served this position for many, many years, and his achievements are great, and we are all glad today that he had this position for so many years. So he, of course, had the opportunity during this appointment to start very important projects like the Eastern Europe project, and also to establish the rolling program, which we all know is very important in the education of all maxillofacial surgeons around Europe. So let's continue with what I think is, when I think of one word about Professor Julio Acero, then it's the word teacher. So it's the Greek word daskalos, which I think is the greatest honor to say this to an individual, that he's a real teacher, because Professor Acero has given all his life and all his career in educating our colleagues around the world. So I told you already about the Eastern Europe project, which Professor Julio Acero, as Education and Training Officer, started, and this program started in Romania. And of course, the idea was to support countries where the specialty was weak, and he went personally there, and also a team of all maxillofacial surgeons from several countries, and supported, as you see here, this is the events in Romania. But it continued with many educational activities also in Poland. You see here the University of Warsaw. And then we had the opportunity also to travel together to Skopje and also to Prague, where Professor Acero also organized educational events. So the Eastern Europe projects, and this is only a short overview of this project, was very important and supported European countries which were weak in the specialty of oral maxillofacial surgery. And of course, Professor Acero has appointed all important positions of our speciality, such as that he was the president of the International Association of Oral Maxillofacial Surgery, but he used this position again to educate. So he started international projects outside Europe. So, of course, a lot of projects in Asia, like here you see Professor Acero teaching in Sri Lanka and also in the Philippines. And of course, Professor Acero went also to Africa, and he organized many educational events in several countries in Africa, and we know how the situation there is extremely difficult, but he managed also to do even surgery on patients there, and helping the patient, and also showing to the local doctors how to do the surgery. So I think it's not only education. Of course, it's mainly education, but here is much more. Is helping people, helping the community to deal with the patients in need. And of course, this is something I'm very proud. Professor Acero supported the Vienna courses, many years, international courses, where he taught and has educated more than 300 surgeons coming from several parts of the world. And of course, he was many times in Greece. He was the first time he was at the I think, I'm not sure if it was the first time, but he was here during after his wedding. So he had a very nice time. And then he was there in 2003 during the ICOMS. And then many times he has lectured at many Hellenic congresses, and also has been the honorary member of the Hellenic Association of Oral Maxillofacial Surgery. But not only that, he's an individual who really loves this country, who loves Greece, who supports Greece in every possible way. Now he's already registered as external professor in the registry of the School of Dentistry and of the University of Athens, and supports all procedures we do in the election of professors. So I would say, and this is my last slide, he's a Philhellenas. And this means that he practiced the Greek culture and the Greek spirit. And for that, we're all honored and very glad. Thank you very much, Professor Acero, for being here and taking this award.
Αναγόρευση του τιμωμένου καθηγητή Julio Acero. Ανάγνωση των κειμένων του ψηφίσματος του Τμήματος, της Αναγόρευσης και του Διδακτορικού Διπλώματος από τον πρόεδρο του Τμήματος Οδοντιατρικής, καθηγητή Φίβο Μαδιανό.
Εθνικών και Καποδιστριακών Πανεπιστήμιων Αθηνών. Ψήφισμα του Τμήματος Οδοντιατρικής των Επιστημών της Υγείας Σχολής. Τύχη αγαθή, πριτανεύοντος εν το Αθήνησιν Εθνικό και Καποδιστριακό Πανεπιστημίο, μελετείου Αθανασίου Δημοπούλου, κοσμητεύοντος εν τη των Επιστημών της Υγείας Σχολή Εμμανουήλ Πικουλή και προεδρεύοντος εν το της Οδοντιατρικής Τμήματη Φίβου Μαδιανού, έδοξεν ομοφόνος το τμήματι Julio Acero, Τα του Ασκληπιού έργα μέγιστα επιστάμενων, την οδοντιατρικήν επιστήμην έργοτε και συγγράμμαση προαγαγόντα και την εαυτού φιλανθρωπίαν πολλαχή επιδειξάμενον, προς δε τούτης εύνουν της έλυση διατελούντα, επενέσετε αυτόν και του της οδοντιατρικής τμήματος διδάκτορα επίτιμον αναδείξε. Το δε ψήφισμα τόδε εις μεμβράναν αναγράψε και τον του τμήματος πρόεδρον δημοσία εντιεθούσι τη μεγάλη αναγνώντα και τα στιμάς ανυπώντα, επιδούνε αυτό η αν ημέρα η αναγόρευσης γέννηται, καθάν ενόμιστε. Εγένετο Αθήνηση, μηνός Σεπτεμβρίου, 8η και 20η, έτους 1ου και 20ου και δυσχιλιοστού από Χριστού γεννήσεως. Ο πρόεδρος του Τμήματος Οδοντιατρικής, Φίβος Μαδιανός. Αναγόρευσης. Επιδίπερ το Τμήμα Οδοντιατρικής της των Επιστημών της Υγείας Σχολής του Αθήνησιν Εθνικού και Καποδιστριακού Πανεπιστημίου, Julio Acero, άξιον απέφυνε το επιτίμου διδακτορικού αξιώματος, η δε της των Επιστημών της Υγείας Σχολή, του τα παιδέξατο και ο πρίτανης της σχολής γνώμη επινεύει, διατάφτα εγώ, Φίβος Μαδιανός, καθηγητής της περιοδοντολογίας, νυν δε του Τμήματος Οδοντιατρικής πρόεδρος, χρώμενος τη δυνάμει ειν παρά το πανεπιστημιακό νόμον και του Τμήματος έχω λαβών, Julio Acero, επίτιμον διδάκτορα του Τμήματος Οδοντιατρικής της των Επιστημών της Υγείας Σχολής του Αθήνησιν Εθνικού και Καποδιστριακού Πανεπιστημίου, δημοσία αναγορεύω και πάσας αυτόν τας προνομίας τα στο πανεπιστημιακό τούτο αξιώματι παρεπομένας απονέμω. Εγένετο Αθήνηση, μηνός Μαΐου 11η, έτους Δευτέρου και 20ου και δυσχιλιοστού από Χριστού γεννήσεως. Ο πρόεδρος του Τμήματος Οδοντιατρικής, Φίβος Μαδιανός. Ελληνική Δημοκρατία, πριτανευόντος εν το Αθήνησιν Εθνικό και Καποδιστριακό Πανεπιστημίο, μελετίου Αθανασίου Δημοπούλου, καθηγητού της Θεραπευτικής Ογκολογίας Αιματολογίας, κοσμητευόντος εν τη των Επιστημών της Υγείας Σχολή, Εμμανουήλ Πικουλή, καθηγητού της Γενικής Χειρουργικής, προεδρευόντος εν το της Οδοντιατρικής Τμήματι, Φίβου Μαδιανού, καθηγητού της Περιοδοντολογίας, Julio Acero, αποδόγματος ομοθήμου της των Επιστημών της Υγείας Σχολής, εις τους επιτίμους διδάκτορας εγκρίνομαι Αθήνησιν μηνός Μαΐου 11η, έτους Δευτέρου και 20ου και δυσχιλιοστού από Χριστού γεννήσεως. Ο πρίτανης, μελέτιος Αθανάσιος Δημόπουλος, ο κοσμήτορ Εμμανουήλ Πικουλής, ο πρόεδρος του Τμήματος Οδοντιατρικής, Φίβος Μαδιανός.
Περιένθεση του τιμωμένου με την τίβαινο της σχολής από τον κοσμήτορα της Σχολής Επιστημών Υγείας, καθηγητή Εμμανουήλ Πικουλή. Ομιλία του τιμωμένου καθηγητή Julio Acero με τίτλο Surgical Treatment of Tumors of the Mid-Face.
So, καλησπέρα, I have to say ευχαριστώ, the first. Yeah. So, may I? Your Excellency, Professor Meletios Athanasios Domopoulos, Rector of the National and Kapodistrian University of Athens, Professor Pikoulis, Dean of the University, Professor Madianos, President of the Dental School, Vice Rector, other authorities, dear colleagues, ladies and gentlemen. Today is a very important day for me as a university professor and as a scientist. I consider one of the greatest honors received in my academic life to be awarded the title of Doctor Honoris Causa by the National and Kapodistrian University of Athens. The title of Doctor Honoris Causa is the highest honorary title that can be conferred by a university. Moreover, this ceremony has a very special significance for me as it is held in Athens, Greece, the place where European culture was born and scientific medicine originated, and also because this title is awarded by the National and Kapodistrian University of Athens, an institution of the highest international prestige. May I take this opportunity not only to express my deepest gratitude for this honor, my deepest personal gratitude, but also to greet you on behalf of Professor Saad, the rector of my university, and all of authorities of the University of Alcalá, which is one of the oldest universities in Europe, founded in 1499, and which clearly appreciates the high dignity that is bestowed to me, being a professor of the University of Alcalá, and therefore this honor is also to university. My thanks to the Senate and all authorities of the National University of Athens, as well as to the Department of Dentistry for the proposal, and to the person of Professor Christos Perisanidis, head of the Department of Oral and Maxillary Surgery, for the proposal. Athens, as Professor Perisanidis said in the Laudatio, had a special importance in my personal and professional life. Here, I celebrated my honeymoon and came for tourism with my family, to whom I sent a memory at this important moment. But Athens had also an important impact on me as a surgeon and as an educator in the specialty of oral and maxillary surgery. The World Congress of the Specialty, as Professor Perisanidis mentioned, was held in Athens in 2003, and here I was attending, was one of my first international conference, and finally I became president of that association, the Global Association. Probably maybe Athens was also critical in the embryonic life of that participation in the international association. I was presented in Athens with the appreciated title of honorary member of the Hellenic Society of Oral and Maxillary Surgery, and was a lecturer at numerous scientific meetings, proudly having the appointment of external professor at the university and taking part in a smooth way in the process of selection of associate professors, etc. So I feel another member of your university. My recognition, therefore, to the excellence of its professors and specialists in oral and maxillary surgery, who have a high international prestige, as evidenced by their participation in the different scientific and educational activities of the specialty at the European level, and the current very important position of Professor Perisanidis as the education officer of the European Society of Craniomaxillofacial Surgery. So some small memento of how I met Professor Perisanidis for the first time in a course in Macedonia. I have to say that at that time I didn't know you, but our friendship also with Professor Papaderogakis, also Dr. Milonas, I was taking part in the European activities, and finally starting serving the association as teachers. Now you have to serve the association in a prominent position. For me, the most important position of the association, more important than the presidency, which is serving education for Europe. And also I have to mention, instead of my lecture, that my speech, that also I have been promoting and to have the European Congress in Athens in the future. It will be under Professor Calabresos, currently serving in London. So, ladies and gentlemen, I am sure that the high honor conferred today to me will suppose a great encouragement for me to continue contributing to the international dissemination of the values of the National University of Athens in terms of continuing promoting the excellence, the European cultural spirit, and the progress of science through innovation. Thank you, Evaristo. And continuing with that, we were talking about innovation. I am serving as an assistant, in the healthcare in the Ramon y Cajal University Hospital, which is associated to university, and one of our preferred topics is oncology and reconstructive surgery of the head and the neck. And today, the topic that I, in a, let's say, brief way, we try to highlight is the surgical treatment of tumors of the mid-phase. You all know that treatment of the tumors of the head and the neck, and our rector, I say our rector because I am part of the university, is also engaged in treatment of when the time-serving university allow for it, serving patients with tumors. So this has to be faced in a multidisciplinary way. We will have the tumor boards and we will discuss the treatment, but finally many of our cases are treated up to now with surgery. So what are the objective for treatment of the tumors of the head and the neck? Mainly is to cure the patient, but also to perform the rehabilitation of our patients in terms of trying to restore the aesthetics and function of our patients. So reconstructive surgery is today an important part of the treatment of tumors in the head and the neck. So tumors especially affecting the mid-phase has a devastating effect in terms of affecting the psychology of the individuals. So we also are facing the difficulty of this anatomical area. The lower third of the face also have relationship to the neck, the mid-face also, in a metastatic way, but concerning the relationship between the mid-face, the skull base, critical functional structures like the eye globes, also speech, deglutition, and also the relationship protecting the brain. This is a very complex anatomical area, but moreover, it's in a different way than other parts of the anatomy, and especially also in our part, the lower part of the face. Removing in a safe way tumors affecting the mid-face is not so easy because the anatomical critical structures may difficult frequently to get safe margins of resection. So this is a problem in the mid-face, and we talked about innovation. This is one of the values of the university, of the National University of Athens, and innovation is really playing a critical role in the treatment of tumors affecting this area. I will try to highlight this in a brief manner. So summarizing, surgical treatment for a mid-facial tumor has to plan a safe approach, has to plan also a accurate resection, and to plan the reconstruction. So taking account also that we are dealing with a patient, with a person, which is not only a tumor, and this has this complex surgery, and especially concerning complex reconstructive surgery, and also to take in account comorbidities, etc. So approaches, I will not enter in technical details. This is not the, let's say, the purpose of one lecture like this in so special days, a special ceremony, but you know that different approaches, we try to be more conservative. Endoscopic approaches have been now one of the critical aspects in our approaches in the mid-phase, also with other specialists like ET, etc., but also conservative approaches through the mouth, or I will show you one new technical detail we have published recently. And so this approach will lead to the resection of the tumors, depending on the area. You know that we have to be accurate and to have a classification in order to remove the tumors, and to try to have a protocol in order also to base our reconstruction. So what will be the major problems after midfacial resection, a major resection in the midface? You face with functional problems, depending if you preserve the eye globe, you have to provide support. If you remove, let's say, the floor of the orbit or the internal wall of the orbit in terms of speech intelligibility and also in terms of deglutition, the removal of the maxilla, lack of dentition, lack of competence in this area. You remove the eye globe, you have to provide also, in the case of exenteration, a filling of the cavity, and this has to be, in our opinion, performed in an immediate way. Immediate reconstruction is, in our view, strongly advised, and I refer to my chapter in the American Clinics of Oral and Maxillofacial, where we deal with reoperative midfacial reconstruction, highlighting the problems of the secondary reconstruction. So, in terms of avoid these problems, we have to. Our objective will be to restore the function and to restore the facial harmony, if possible. And for that, we have today incredible means available. We have a microvascular flaps, bone flaps, soft tissue flap, but we have to have a protocol. We have to start with the. Always, our philosophy is you have to use the most adequate, the more adequate method to repair a defect. It will be let's say, bad to restore a small defect like this case. It's a mucoepidermal carcinoma in a child, which really can be mucosalized spontaneously. It's a low-aggressive tumor using a microvascular flap, or to perform a complex midfacial scalp-based reconstruction without using a microvascular flap. So the flap has to be selected according to the problem. And today we can have a situation like this. If I would say this is a preoperative, no, it is a postoperative situation. This is what I want to take to this distinguished audience, that this gentleman was submitted to a maxillectomy due to adenoid carcinoma, and after a radical, a maxillectomy beside the floor of the orbit and reconstruction with a fibula flap, plus a secondary dental rehabilitation with implants, the patient has this postoperative aspect. So our goals were achieved. We have performed the cure of the tumor. This patient is alive many years after the operation, and moreover has a correct aesthetic and function. This is our goal. But sometimes this is not possible, and sometimes the accurate reconstruction is not possible due to, let's say, a problem like a loss of a flap. This can happen, but sometimes lack of planning. And as Benjamin Franklin said, if you fail to plan, you are planning to fail. And in this sense, we are so fortunate that maybe the youngest don't know how that was, but not so many years ago we had to plan our resection, which in the mid-phase is really complex due to anatomy, only based on the clinical examination and plain radiograph. Afterwards, the CT was included, and this was an advantage. But today, we went in not so many years, and we are now in the history of Europe is born here, but the history of surgery is not so long like the history of Greece, which is the history of Europe. And our grand Professor Papadakis always said, this I am the grandfather or father of that, but these are our grandfather were there. But now this is not so many years. Now we are so fortunate that we have available incredible digital technology which has an impact in the treatment of our patients. As Professor Perisani said, finally, our patients are our goal. So we are in the digital age. The young people are born in the digital age. We are digital immigrants, but we all have to have this technology. And so with that, we know that we can plan. We can plan a resection, we can plan a reconstruction, and we can plan implants. We can perform a navigation, which helps us during the operating procedure in order to respect the critical structures, also to know where we are in this complex anatomy. We can plan. These are all cases that we have. We have in our facilities in the Ramon y Cajal University Hospital. We have intraoperative CT navigation, and we can plan. This is very important, not only for reconstruction or for a, let's say, beautiful surgery, but also for the benefit of our patients. Now we are planning resections in the mid-phase, taking account not the tumor, but the margins that we want. We plan the margins. We design the margin, and now we are performing a research and conducting and directing a doctoral thesis, one of my co-workers, comparing the advanced malignant mid-facial tumors, T4B, operated on without navigation and with navigation. The preliminary results showed a percentage of free margin about 65%. Free margin in the mid-phase T4B, which is really good in comparison with a less proportion in the non-navigated patients. And finally, also in some cases, we perform intraoperative CT. This is a tumor. We are superposing the tumor with the intraoperative CT of the resection, looking at the margins we got. So, but this is a protocol, as mentioned. I will not enter, but you know, for complex defects, microvascular surgery is the most updated technique we need, and for smaller defects we can use temporal flap or local flaps, or sometimes prosthetic if the patient doesn't allow. Some examples of the different possibilities we have in the mid-phase. This is a case of a young lady having aggressive odontogenic tumor affecting the maxilla. Some examples how we can plan. We, in this case, with a small lateral nasal and lip incision, is showing the maxilla, but showing also the inner aspect of the buccal mucosa with the facial vessels in that area. Why? Because what we perform was we design the fibula flap, and we perform an intraoral anastomosis in order to avoid any other incision in the neck. So we perform the macrovascular anastomosis of the flap, which is a problem in the mid-phase due to the necessity of long pedicle, into the facial vessels intraorally. And moreover, in a second stage, dental implants was put by the implantologist, and this is the result. So a conservative incision, which now, in this case, we have to remove the floor of the orbit and perform a small incision in the lip, but the traditional Weber Ferguson is not, I haven't performed only in the cadaver course in Vienna to show it to the students. This is the patient. So this is, you as surgeons would be proud if you have removed performed a whole hemimaxillectomy in a young lady. You face, or you meet her in a wedding ceremony because she was relative to one of our residents, and you are proud of being in the picture with her due to the result, and she is cured. Unfortunately, this patient was not cured due to distant disease. This is a case of a sarcoma affecting the upper maxilla, affecting the floor of the orbit, affecting the skin. So with this case, I want to illustrate the advantages of the new technologies for the resection. In that case, you can see here the extensive tumor. We decided surgery was potentially removal with margins, and in fact, you can see here how with the navigation pointer you can design exactly where you are in the pterygopalatine fossa. You can know where is the carotid artery. In this case, was an orbital centration, but if not, you will know where is the optic nerve, and it allows you to perform the most extensive resection that you could apply. Reconstruction, a chimeric flap, and finally free margins, local control, regional control, but unfortunately after chemotherapy, radiation therapy, but metastatic disease came and the patient passed away. So finally, cranioorbital tumors, 2 cases to end my presentation. You know that this is one of my preferred areas, and here we have another additional goal, which is to perform the restoration of the barrier between the intracranial contents and the nasopharyngeal tract in order to avoid fistula, meningitis, etc. We have different methods to repair that. We have to repair the dura. We have to repair also sometimes the bone. Sometimes it's not necessary. In fact, when the facial harmony is not distorted by removing some bone, let's say the temporal bone, it's not necessary to restore that, only if you include the temporomandibular joint. But if not, you can simply repair it by putting soft tissues, normally microvascular. You can see this is the patient below is not an approach. This is the resection. I performed one of these 2 days ago. It was an extensive skin tumor and the whole skin of the half face with the orbital exenteration plus orbit, but was removed. In this case was extracranial, and we could simply putting a big microvascular flap. So this is a lady which had a sarcoma also affecting the Vidian channel, the foramen rotundum, affecting the pterygomaxillary fossa, the orbit. In another hospital, they tried chemotherapy. This was not the protocol. If you can perform surgery aiming to have a free margins, at least the most extended to complete with combined chemoradiation, this would be the option. And I want to share with you this new approach. In fact, I didn't find any, and Christoph knows it, any other reference, which is combining the transconjunctival approach in a perilimbic way with either a coronal approach for upper tumors or a oral approach for lower tumors in order to perform en bloc maxillectomy with orbital acceleration without any incision in the midface. In fact, we approach, this was published in the International Journal recently, and in this case, which typically will be submitted to a extended Weber-Ferguson with orbital acceleration, which you know that has a big sequela afterward dropping of the face, we always approach a posteriorly extended tumors, malignant tumors of the maxilla, of the upper maxilla, through an inferior approach, through a lip split mandibulotomy. We don't use an anterior approach for these tumors. Combining this for mastectomy with the coronal approach for the infratemporal fossa, and also for with this transconjunctival approach, we are able to detach the whole facial mask of the craniofacial skeleton, and this en bloc specimen was removed without any incision in the midfacial skin. You can see the extensive resection posteriorly, and now the neurosurgeon under navigation is removing the tumor in the skull base extracranially. Reconstruction, we provide bone for the maxillozygomatic buttress with again a chimeric latissimus dorsi and scapula flap. You can see here the flap for filling the orbit, filling with fatty tissue, the muscles for the palate, and the bone for the midface. And this is the situation. So this is a reconstruction. Most important goals. This is the midfacial resection without any incision. Facial nerve is working perfectly. After the radiation therapy has a retraction of the conjunctival sac, but it's possible to use that. The eyelids work perfectly. And finally, is still alive after chemoradiation. I got twins 2 years ago, and now it's 9 years after operation. This means that these our goals were achieved. And another case, finally, to show one case to show how we integrate planning of the resection and reconstruction with an implant. When we perform in a benign tumor with no radiation, orbital resection, like in case of meningioma of the sphenoidal area, we design reconstruction with an implant, a personalized implant of normally of PEEK. In this case, it was a meningioma. So we performed the virtual surgery, virtual resection, has a previous surgery because of another meningioma. We designed an implant before the resection. Now we have the implant, but we have to perform the resection. What we do, guided under navigation or with surgical guides, we can combine them. So we transfer the planning of the resection into the surgical field, and we have the implant for a hole, for a defect that doesn't exist. We have to create the defect. And this is how we immediately place the implant, and very easily. And this is the postoperative results of this patient. And the other extreme, when we have not in this cranio-orbital surgery, we don't need to restore the bone, but we need to provide a coverage. This is a low-grade sarcoma affecting the mid fossa, the medial fossa, the pterygopalatine, the infratemporal space, etc. And you can see how is the extension in the skull base, which needed a control with the neurophysiologist of the brain flow, and how we can perform these extensive resections. Why? This is the brain, dura, infratemporal fossa, pterygopalatine, posterior maxilla, skull, and we can perform this because we can repair that using, in this case, a rectus abdominis microvascular flap. And this is the result. The patient is under control. It's a sarcoma, but it's under control. And this is so, dear colleagues, authorities, dear authorities, it's been, I try to keep this in the present and not to put in the past, to be here sharing with you this important ceremony, and hope that I have been able to express with some few words my impression, my deep impression, and my deep gratitude and my recognition to the University of Athens, the National and Catholic University of Athens, to thank all persons involved in this complex process. I know that it's very complex, the process to appoint, to award a doctorate honoris causa, and to greet my colleagues in maxillofacial surgery here in Greece, in Athens, and to encourage them to continue working for the specialty for our students, pre and postgraduate, and finally for the patients and for our society. So thank you very much, and we would be happy to welcome all of you in Madrid at the European Congress to be held in September, where our colleagues will have a prominent role. Here sitting various speakers, so I'm sure that you all will be coming there. And so I thank you, and ευχαριστώ.
Πέρας της εκδηλώσεως, σας ευχαριστούμε πολύ για την παρουσία σας.